it's just safer for everyone if I only have one thing in my hand. So I'm going to talk about an opportunity for Dallas County, but what I really want to do is like follow up on everything that you just said, because so much of what you said like triggered stuff in my head. I work in suicide prevention for the VA, but a lot of what I do is for law enforcement, is for first responders, because the culture is so similar between first responders and our military folks that I spend a lot of time talking about suicide prevention and mental health with both pieces. One thing that like leaped into my head when she was talking was the average human will encounter 5 or 6 traumatic events over their lifetime. A first responder will, during their career, will have somewhere between 100 and 400 traumatic events. So I think there should be a dog in every department. I talk about peer support with anybody that will listen, and so I want to just ride around with you guys. And anyway, I got kind of choked up when you were talking about the story with the little boy, and so I got to regroup so that I can actually talk about what I came to talk to you guys about. When I put together my slide deck, I was like, it's winter, right? And so I did this lovely winter slide deck for a day where it's going to be 60 degrees. So I apologize for that, but here we go. Okay, so this is my agenda. This is what we're going to talk about in the 15 minutes that I have. Why even talk about suicide prevention in Dallas County? What is already being done, because there are amazing, amazing, amazing things happening in Dallas County already, but you may not know that, or your community may not know that. And so what could we do to pull this all together so that we are working smarter, not harder? We're all working together because we can do so much more together than we can do individually. And how do we get that into our community so that our community knows not only the wonderful, wonderful resources that already exist, but maybe it's something that they feel passionate about and they would want to be involved with, and that would be a positive thing for them. Maybe they've lost someone to suicide and they want to be able to give back. There are ways that we can do that. You guys are the forerunners for that. So we'll talk about that, and then maybe what can we do next? So this is just my introduction. In the United States, 127 people die by suicide every day. In 2022, Iowa lost almost 600 people to suicide. This was a giant increase from the year before. 2021 was the first year in Iowa that we actually had a decrease in suicide deaths over the last 15 years. And then immediately the next year it went back up. Of those almost 600 Iowans, 17 of those were in Dallas County. All of my numbers you need to take with a grain of salt. This is what's reported. This is what's reported to the state. That doesn't mean that there weren't other deaths in Dallas County that were actually suicides, but maybe the medical examiner did not record them as such. Or if in a case of an overdose, it's almost impossible to differentiate intentional versus not intentional unless there's a note or some other thing. And so, grain of salt with all my numbers, okay? I don't want you to go back and go, no, this is all that we had. No, there's probably more. Your first responders or law enforcement, they know what the real numbers are. I did a similar presentation in Jasper County, and I was like, oh, you guys had it, your numbers came down this year or whatever, and the sheriff's looking at it and he goes, no, they didn't. And I went, oh, well, now I'm just embarrassed, but this is what the numbers I can get from public health. So, my goal is that we connect with all of the residents of Dallas County. I almost said Polk County, because that's where I live. Even though I work for the VA, and my people are service members, veterans, and their families, what I'm proposing to you guys is for your entire community, because service members, veterans, and their families are part of every piece of every part of your community. And so I can do my job, even if what we're doing is for the whole community. So the only people that need to worry about whether or not we're meeting that measure is me. I usually say the only VA you're getting is me. Like, this is not just about VA. It's just a pulling together community member and stakeholders to create coalitions that will work together to prevent suicide. The average coalition meets monthly, but the benefit from that is so much bigger than just that meeting. You guys probably all sit in meetings where everybody goes around and shares what they have going on. That's not what I'm talking about. I'm talking about action-focused initiatives. This is the goal we want to meet, and this is how we're gonna get there. That's what I'm talking about. So, because we gotta talk about data, there's a lot of information on this slide. And actually, it's fairly big here. Normally, you can't read it. So here are Dallas County's numbers for the last, however many years that is, from 2015. What happens is, the health department, used to be public health, puts out a vital records report every year. And there's one page in that report that has county data on it. I don't know if you guys have ever read that report. It's 250 pages long. You gotta wade through the baby names and stuff to get to the stuff you want. Yeah. Anyway, I mean, there's a lot in there, but it's a very vast report. But the one page has county data, and it starts out with where the most deaths are, which is always Polk County because we have the most people. And then it lists out other counties that have more than 5. If a county has 5 or less suicide deaths in that year, they'll just have a star. That information is suppressed because, I mean, would you say there are 105,000 people that live in Dallas County? You guys might not know every single person that this has happened to, but in a more rural county, they would know who those people are. And so it will never change. It will always be suppressed if it's less than 5. Dallas County has never been suppressed in the time that I've been working in this position. You guys have always had more than 5. When you look at the rate, the national rate is about 14. So any of those years that Dallas County is higher, your rate is higher for the number of suicides you have in your county. People are usually more interested in their county data than the national and the state, but I put it on there anyway, just so you can kind of see trends. Nationally, we had a few years of the numbers coming down. We didn't have the same thing in Iowa. For our veterans, we also, nationally, we're seeing that decrease in suicide deaths, which is great. In Iowa, we've done this. Again, grain of salt, this is just what the numbers that are reported to us. Already in 2023, as of October 16th, we have already lost 333 Iowans to suicide this year. The 2022 number being higher, I don't want there to be a lot of despair with that. It's kind of normal to see things like this when you've just had a worldwide pandemic or a war or something where lots of people are involved. And what happens is while you're going through it, those people that have a diagnosis and the people that don't have a diagnosis all feel the same level of crappy. And we're all in it together and we all feel bad, and so we all go along. And then when things start to lighten up or end, because the pandemic ended, you guys know that, right? The people with the diagnosis still feel bad, and the people without a diagnosis are going back and living their lives like they always have. And that person with the diagnosis is like, well, why are they okay and I'm not okay? And so we see mental health needs go up, we see suicide deaths go up. So unfortunately, we are right now in a normal period of that increase, but that doesn't mean there's not preventative things that we can do. This is from 2021. This is broken down, this is Iowa data, broken down by, it occurred to me on my drive here that I probably can get this slide for 2022 and I just didn't update it, so I apologize for that. That's kind of a cool thing happening in the world right now is we're getting data so much quicker than we used to. It used to be I'd go into these presentations with numbers from like 2016, and now I'm sharing 2022 data with you. If there's any other data geeks in the room, this is very exciting. So this is broken down by age and race. So looking at those numbers, these are male versus female. Where is, in the state of Iowa, where is our largest group of loss? Men, absolutely, yes.
White men.
Okay, what age?
44-ish. 30s and 40s.
Okay, is that surprising anyone? that's good, because normally it is. Usually what I would get if I said, who are our highest risk, we would get youth. People always say youth. Every once in a while I get folks that talk about the seniors, because we do, lose a lot of seniors. But no, it's middle-aged men. Middle-aged white men.
It's the highest demand group in the world.
Yes. Do you think they make a good poster? Do you think 988's gonna roll out a poster with a middle-aged white man on it? Probably not. They are absolutely the forgotten group, but we have to pay attention to them because they're the ones that we're losing at the highest rate. So, just kind of bring that back together. You guys actually are like a stellar group because most people are like, they don't get that. They're like, it's not who we should be paying attention to. So, okay, what's already happening in Dallas County? This is just the things that I know about. I don't live in Dallas County. So I know that you guys do this. You do your speaker series. You connect each other with resources that are going on in your community. I know that Dallas County did crisis intercept mapping. Crisis intercept mapping is for service members, veterans, and their families, and it's exactly what it sounds like. Maybe some of you guys took part in it. Anyone? Yes, okay. So it's, we did it over in Polk County too, and what we found out in Polk County was, there are amazing crisis resources in Polk County, but our veterans and service members don't know that they're for them. Because everybody thought, well, if it's a service member or a veteran, they have to go to the VA. And I'm like, well, okay, we would die. There are 26,000 veterans just in Polk County. Central Iowa VA has 42 counties, one of which is Dallas County, which I think you guys have 6,000 veterans living in your county. So right there, between those two counties, okay, I do math, sorry, I'm a social worker, it'll take me a minute. 32,000 veterans just in Polk County and Dallas County. All of those veterans are gonna have to come to the VA for services. What are we gonna do with the other 40 state counties? Because we aren't gonna be able to serve them. So, lots of very cool things already happening here. I am talking too much because so, what can we do? The pulling together part. This is just a really quick crosswalk. That's a lot on there, I know, and it's very, very small, but it really is more just for you guys to be able to see what it is. This one over here, and I apologize to those of you that I cut your heads off. I didn't mean to, but I think you're all in this room right now. This is your community plan. This is your county plan. This is your section for mental health. These are the things that you guys wrote 2 years ago? A year ago? That you wanted to accomplish in your county. This is the Iowa plan, Iowa Suicide Prevention Plan. These are all the amazing things that we want to accomplish at the state level. These, over here, those are my goals. My national office, these are the things that they want me to accomplish with my service members, veterans, and their families, who again, are every part of your community. One item that I can show you that's in all three of these is, you guys have on here, you want to improve access to mental health wellness resources and services. One of the things down here was, how do we better follow people through those transitions? So from home to inpatient to outpatient to whatever. How do we follow that better? That's also something that we want to figure out at the state level, and that's also something we want to figure out at the national level. At the VA, we are blessed. We can follow our veterans from start to finish because they're encapsulated in the system. But if our veteran goes somewhere outside, we sometimes lose them. And we don't know what's happening to them out here. And again, the VA cannot serve every single veteran in the state of Iowa. We have to rely on our community partners. We also have veterans that would never in a gazillion years set foot on VA grounds, and that is their right. It is a voluntary service. And so again, we need to rely on our community partners. But we gotta be talking to each other, and we gotta be working together so that we don't lose those people while they're transitioning. What does the team look like? Well, I'm looking at y'all right here. It's community partners that care about mental health and suicide prevention, and they come from all walks. Your mental health providers, your primary care providers, emergency responders, the school system, survivors of suicide loss. They are your best voice at a table for something like this, because they have been there and they know what worked for them or didn't work for them and what we could do going forward, so that it's not just a bunch of professionals that are saying this is what we should do for prevention, and the people that have lived it are like, well, that would never have worked with me. That's actually offensive to me, whatever it is. We need that voice so that we can be respectful to the folks that have lost someone to suicide. Timeline, y'all already are like leaps and bounds. Dallas County is leaps and bounds ahead of other places because you're already doing so many amazing things. But this group's doing this stuff, and this group's doing this stuff, and this group's doing this stuff. And there might be an easier way to do it if we work together versus each body feeling like they had to be doing the same burden. Step 2, well, me telling you that we could do this. And then from there, it's kind of up to you guys what you want to do. This is me. I'm a community engagement and partnership coordinator. My entire job is working in my catchment area to help people stand up or enhance groups that already exist so that you have structure and balance, and it's evidence-based and data-focused and all of those kind of things. These are all the things I can offer you. Does it work? See all those blue squares? That's where these groups exist, where they didn't exist before in the state of Iowa. So what's next? Well, that's absolutely up to you guys, your county, what you want to do next. It can look like all kinds of things because you guys already have amazing things going on here. It could just be an offshoot of something that's already amazing that maybe just needs a little bit more focus on mental health and suicide prevention. It could be a completely separate group that gets started up from ground up. It's not as daunting as it sounds, I promise, because it's already, we already know how to do it. It's just a matter of putting in the pieces. Individually, we are a drop, but together we are an ocean. I love this expression. I have it on like everything that I use because it's exactly why my job was created. In the United States, we lose 17 veterans to suicide at any given day. Of that 17, only 6 come to the VA. That means there's 11 that are going somewhere in the community. And so my job is created to reach those 11 because we're losing more veterans that don't come to the VA than do come to the VA. But I can't do it by myself. I have 42 counties and my reach is only so far. So I rely on you guys to expand that reach, and this is me. Did I make it in my time? Okay, there's so much information in my head that I wanted to share with you that I'm like, oh my gosh, reel it in, Lori. Okay.